Hello, everyone. Good morning. Welcome to the very first episode of our Maxime webinars, which is called Maxime Talks, wherein we are going to talk about relevant matters about your fur babies because your fur babies matter. This is Dr. Roniel Montero, and I am the technical and sales specialist for Maxime, and I will be your host for this morning. We are happy to have with us now one of the country's leading and most experienced veterinarian, and of course, a dog lover himself. Dr. Jomer Castro, the resident veterinarian of Ask a Vet Medical Clinic. And today we are happy to have with us one of the country's most experienced veterinarian and a dog lover himself, Dr. Jomer Castro. He took up Doctor of Veterinary Medicine at the University of the Philippines, Los Baños. And after some time practicing here in the Philippines, he took his practice abroad in the United States of America, specializing in orthopedic surgery for small animals. Right now, he is the current mainstay resident veterinarian of the Consultavet program, which is aired through Edge TV Philippines and Doctor's online radio shows. Okay, guys, let's welcome Dr. Jomar Castro. Hi, Dr. Jomar. Good morning.
Good morning to everyone. Guys, hi, a pleasant MECQ Saturday morning to everyone. I want to welcome you all to the very first episode of Maxime Talks. And our topic for today is about canine parvovirus. I'm really very excited today to discuss this to you, and I will really try my best to really explain this to you the easiest way possible. I don't want to be very, very technical here, but I'll try my best to explain it to you in the most understandable way possible. Okay, guys, let's start off.
All right, Doc. Thank you. No, I think this topic right now is very timely kasi based na rin sa mga reports coming from our vet friends, there is a surge on the cases of this disease. So guys, we are going to talk about canine parvo virus. All right?
All right.
Oh, next slide, please.
So what is canine parvovirus, guys? Okay. If you would notice, uh,
Uh,
the
yeah.
canine parvovirus is the most dreaded disease in puppies. It
All right,
happened.
guys, no? Just want to remind everyone na please send in your questions. How? Just put your comments or your questions in the comment section below. And of course, get a chance to have a Lazada discount coupon that you can use for Maxime. So mag-ask ka lang ng questions, you'll get the chance to have a discount coupon to buy your Maxime products. Sabi nga ni Susan Rosas, di ba? Huwag mahihiyang magtanong. All right? So, Doc Jomar, ito yung kanina pa gustong tanungin sa atin ng mga viewers natin. So, ano nga po ba ang canine
Yeah.
parvovirus and paano ito na-contract ng mga alaga nating puppy? Take it away, Doc.
Like I know everybody is familiar with the virus. We have coronavirus now. Canine parvovirus is also a virus that affects dogs. And I want everybody to understand that this happens as a puppy. Okay? Your dog will get sick if you do not vaccinate your dog. Okay? And the number one problem in puppies is parvovirus. This is the most common problem that all households experience, especially when they get a new puppy. Okay, guys, this is the problem. Okay, when you do not vaccinate your dogs, you don't bring them to a vet before you bring them home, your dog would get sick. Okay, this is very contagious. Okay, guys. So on the next slide, we will show you how this works, how does parvovirus affects a lot of our dogs. So when it does not happen, let me always tell you, it does not happen in old dogs. Okay? Always remember that it happens only in small puppies. The maximum age, if I remember it right, the maximum age that dogs have that are infected with this problem is, I think, maximum is 2 years. But in my practice, I've seen it every day. It happens in puppies 4 to 6 months of age. Okay. So when how does let me tell you a lot about the canine parvovirus so that you would understand it. Okay. Uh, Doc Raniel, can you please turn on to the next slide, please?
All right, Doc. Yes, Doc. Next topic, of course. Let us discuss now how naman, no, papaano yung natatransmit yung canine parvovirus to our pets. So, what are the sources of contaminations?
Okay. When an unvaccinated dog gets sick with parvovirus, what happens is he experiences severe bloody diarrhea. And when this happens, he would always shed the virus in a lot of the areas where he will poop. Okay, when he poops, he scatters the infected poop in a lot of areas. So when another dog, another puppy goes and sniffs the infected poop, he will be infected also with parvovirus. What happens is, okay, this goes inside his mouth because, you know, naturally dogs are very inquisitive animals. What they do is they sniff, they smell, they taste, they lick, whatever they smell. So when this reaches another dog, okay, the parvo in goes inside the mouth and multiplies in the dog intestine. Okay, when this happens, okay, the dog becomes a carrier already. Okay, and when what the virus does is it replicates in the intestine and it destroys the intestinal lining of the dog. That's the reason why he will keep on pooping over and over again. Now, when the virus destroys the intestinal lining of the stomach, blood will come out. Okay.
All right.
Through this, through the diarrhea, okay, he will shed off the virus. When he becomes sick, you have to bring him to a vet. Okay. You have to bring him to a vet. This is a very difficult problem to solve. And I want you guys to remember that it's very hard to treat it at home. Okay. If you're not really, you don't have a medical background, you should bring it to a vet. Guys, bring it to a vet. This is my strong advice because always remember 95% of the time when your dog gets infected with the virus, it dies. 95% of the time. And that's a very high data. That's a very high data to consider. Okay. The chance of survival is just 5%. So always remember that. Okay.
All right. Thanks, Doc Jomer. No, now we have actually touched what is canine parvovirus and paano napapasa ito sa ating mga alagang pets, no? So, let's answer, Doc, no, some questions from our viewers. So, one of the questions, Doc, that was given to us, it is siguro natanong ito because of sinabi natin kanina that parvovirus only happens or mostly happens during puppyhood. So the question states, can adult dogs 1 year old and above can still acquire parvovirus disease?
Yes. That is a very good question, Doc Raniel. Ano?
Yes.
Like I mentioned earlier, the maximum age of the dog that may be infected with the virus is 2 years old. If your dog is not vaccinated, vaccination starts, always remember, vaccination always starts at 6 weeks, 8 weeks, 10 weeks, and 12 weeks. Now, if you forgot to vaccinate your dogs and he gets exposed to a dog that got sick from parvo, he can still get the virus. Okay? So 1 year old is still sensitive for this. Okay? But when the dog gets the virus and he gets cured and he gets treated and he becomes okay, he is already protected from the virus. Meaning, meron na po siyang antibodies versus the virus and he can withstand and he cannot reacquire the parvovirus twice. You can only become infected once. Okay? I hope I answered that question, Dr. Daniel.
All
Thank
right,
you for that.
thanks, Doc. No, thanks, Doc, for that. A very concise answer. No, I hope we answered your questions, guys. No, for more questions, just don't be shy. Ask your questions to the comment section below, and Doc Jomer will answer that, guys. Okay. Uh, Yun, Doc. No, we have another question from our viewer. Question is, how can we get vaccines during the ECQ po? So,
Oh, that's a very good question. Uh, I hope I can answer your question because nowadays it's really very difficult to, go out and do and get a quarantine pass. And I know, but I want you all to remember, uh, a vet clinic is an essential service. Okay, so people know that. Like me, like us vets, we have a task force ID because we're in an essential service. And when in clinics we never close down even during MECQ. So it's okay to go out, especially if it's an emergency, to bring your dog to a vet. Now, I understand you don't want to go out. You want to be very, very careful. You want to feel safe. Kasi nga, syempre, meron pong corona. What I advise is you call your vet and he can schedule a home service at your house. Home service, we call it home service, so that we can schedule. They can schedule the home service where the vaccination shots will be done in your house para hindi ka nalalabas. Okay? That will be easier. I hope I answered that question, Doc. Thank
yes,
you.
Doc, no. Thank you for giving your tips, no. So, guys, just to summarize, again, veterinary clinics are essential for ECQ, no. So, open pa rin ang mga vet clinics. We can bring our pets there and have them vaccinated. And actually, you can contact the vet clinics to their Facebook page if they're offering home services. Then, if they do offers home services, then you can choose that home service na lang for you din naman to feel safe. Okay? All right, Doc Zomer, we have another question. No, maganda tong tanong na to because kanina we were able to answer if it only occur in puppyhood, right? So ngayon
Yeah.
naman the question is there a specific breed po ba ng aso na madaling makakuha ng parvo or specific breed na tinatamaan lang ng parvovirus?
Yes, that's a very good question. Actually, when I was in the States, they already identified certain breeds which are very, very sensitive to the parvovirus infection, especially puppies. And syempre, this is a puppyhood disease. Most of the time, puppies get infected. German shepherds, I understand. Rottweilers. These are the two most common breeds that are very, very sensitive to the parvovirus infection. In fact, I have patients before that whenever these breeds get infected with parvovirus, they're very, very sensitive. They immediately die. Why? They they have a certain bodily characteristic that they cannot they are very, very weak against this virus. That's the reason why when when they get sick, when they acquire infection, parvovirus infection, they would succumb to death immediately. So, as a precaution for everybody, whenever you get this breed, before you bring it at home, you have to get your dogs vaccinated as early as 6 weeks before you bring these kinds of breeds at home because they're very sensitive to parvo. And it's very, very hard to treat them, especially these two breeds, German Shepherd and the Rottweiler. Uh, it's very, very hard for them to recover whenever they have been infected with parvovirus infection. Thank you, Doc Raniel. I hope I answered that question.
Yes, Doc, no. That's a very good question kasi it's not very common na natatanong. So I think nabigyan natin ng answer yung tanong na ito ng ating mga
Mm.
viewers. So Doc, no, let's proceed now. Kanina we have already discussed yung kung ano ba yung parvovirus and how the puppies contract the virus. Ngayon, what if nakakontract na ng virus yung puppy natin? So let's talk about now the clinical signs na pwede nating makita for a parvovirus infection.
Okay. You would see in the slide lethargic. For everybody to know, the meaning of lethargy is lack of energy. Okay? Lack of energy or depression usually is followed by lethargy. Usually puppies are very, very active. I want you to know that, and always remember, whenever you get a puppy, and if a puppy is very, very weak, something is wrong. He is sick. Okay? Whenever a puppy is around, dapat energetic siya, dapat active siya. Hindi dapat siya lethargic. Okay? Hindi dapat siya full of energy nga dapat. Without it, he is sick. This is the number one sign that your dog may have parvo. Okay. Next
Alright, Doc.
is the next slide that you're going to see is diarrhea. Okay. As I mentioned earlier, the virus destroys the intestinal lining of the stomach, intestines of your dog. That's the reason why he cannot control his poop already. Okay. You should like bring it to a vet because it's very, very hard to control this. Okay. And the next sign that is might be seen that you would notice in your puppies is vomiting. These are the three most important signs that you should be aware of when you have your puppy. Kasi these are the things that would weaken your dog. Vomiting, what is the cause of vomiting, di ba? What has is the effect? He will become dehydrated. Same with diarrhea. Whenever he is uh whenever he has diarrhea, he will also be dehydrated. Okay? So that's the three most important things that you should see. Other signs are inappetence. Of course, when they're vomiting and they have diarrhea, they will lose automatically their appetite. They wouldn't have any appetite already. Okay? Very depressed na, and you would see the eyes of your dog. It's glassy eyed. Para po siyang nagmamakaawa whenever he looks at you. That's what you call the glassy eyed stare. And that's very sad whenever you have a new puppy, especially my kids. If you get my strong advice, never get a puppy who is not been vaccinated because your kids will be traumatized with this. Okay? Next slide, please. Now, when this goes on and the diarrhea continues, okay, it will be followed by dehydration, sepsis, and followed by death. Okay, why? Because severe diarrhea causes severe dehydration, severe vomiting causes severe dehydration also. Your puppy will lose sugar in his body, he will lose his energy, and everything will be downhill from there. So always remember, you know what to do for your puppy so that he won't get these stuff. Okay, this is a very dreaded disease, and in a matter of 3 days, your dog will be very, very weak. Remember this. Okay?
Alright, thank you, Doc, no? So, dun sa clinical signs kanina, it's lethargy, bloody diarrhea, and of course, vomiting. No, you just wanna add lang, Doc, no? Yung bloody diarrhea, it has a very distinct smell. Right, Doc? Na parang, pag naamoy mo yon automatic, parvo to. Right, Doc?
Yes.
Parang ganun siya.
So, you are correct, Doc Raniel, because, when the virus destroys the epithelial lining, blood, actually, there's a really distinct smell of blood that comes out of the poop. It doesn't really smell like poop. It smells like pure blood, because that's the thing that is destroyed in the intestinal lining. That's why he would like pass out pure blood from the poop, and that's really very, very sad. It's really sad, and it's really very hard to save the puppy once this happens. So I'm letting everybody know, don't let it reach that point. Don't let it reach that point, because when it reaches that point, it's very, very hard to save the puppy, even including us vets. We cannot save your dog when it reaches that point, because that would be a very chronic stage already that is very hard to treat. So uh, remember that.
Yes, Doc. They should always remember those things, no? Now, Doc, let's
Mm,
answer this, some questions from our for parents here. First question, this is a situational, siguro experience, personal experience na nagtanong sa atin. One of my puppies
mm.
showed signs of parvovirus. So, he has 5 more puppies on the litter. So, will they get infected too? And what should I do?
Okay. When your dogs are unvaccinated, it is almost 99% of the time when your dogs are unvaccinated and one of them catches the virus, yes, almost 100% of the time, they will also exhibit the same signs of parvovirus. Let me refresh you again. Like I mentioned earlier, this is very, very contagious, because in a litter, they are always they stay side by side, they play with each other, they get contaminated with the same poop of the litter, they will surely be infected. So you have to know, and you have to consult your vet on what steps to do. You have to be very, 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 very conscious about this, because you have to act fast, because most of the kennels that I've handled that were infected with parvovirus, they get wiped out because of the severity of this virus. It's very, very, very high mortality and very high morbidity, meaning the contagious level is off the roof. Okay, so you have to learn also later. We'll discuss later. You have to know how to disinfect. Your vet will tell you that. Your vet will teach you how to do it. You have to listen to your vet. Okay, thank you, Doc Raniel.
Yes, that's right. Yung key doon, yung last statement ni Doc Jomar, no? Always listen and trust your vet dun sa mga medication plans na binibigay nila. All right, Doc. So, we have another question. Uh, he was asking if when is the right time to start the warming session and vaccination program to our puppies, no? Para ito siguro dun sa mga new fur parents na
Okay, that's a very good question. Alam mo, I think this is the first time that this question was asked. Okay, deworming. Yes, the earliest, period or time wherein you can deworm your puppy is 2 weeks. But you would notice sometimes they're still very small. Okay, this is the reason why that I advise my clients, if they have a dog that is about to give birth, they should always remember to deworm the mommy dog before he gives birth. That is the first. Okay. Why? Because the adult mommy dog may have worms already, and he can transfer the worms to his puppies before they even give birth. Okay? So when you deworm your mommy dog, okay, the puppies will already be protected. So, but in the event that you did not deworm the mommy dog before he gives birth, you should always remember to deworm your puppies when the mommy dog gives birth as early as 2 weeks.
All
Okay?
right, Doc, no. Just a
I
follow
hope
up
I
Opo.
Mhm.
Just follow-up question lang dun, Doc, sa statement natin kanina na i-deworm si mama dog. Puwede ba nating ibigay kung, for example, how many days before manganak ang safe period para ibigay yung deworming natin dun sa mommy dog? Kasi of course, it's deworming. They were asking maybe baka puwedeng magkaroon ng miscarriage yung mommy dog natin. So,
Yeah, okay.
Doc, yung specific days before manganak si mommy dog na puwede tayong mag-deworm?
Okay. There are certain specific dewormers. You have to really consult your vet about this.
Yes.
Maraming klase po kasi yan eh. Okay. Uh, Actually, during pregnancy, you can deworm your dog as long as you would ask the vet first what type and brand of dewormer is going to be used. Because there are certain brands that should not be given during a pregnancy stage of a mommy dog. Okay? Meron din naman pong types and brands na can be given for pregnant dogs. So you have to consult your vet before you do it. It's not really the time before he gives birth, but during pregnancy, you can deworm it as long as you should consult your vet para maibigay po yung tamang dewormer na safe sa kanya habang siya ay buntis. Okay? Meron din naman pong mga dewormer na safe sa puppies. Okay? Meron din naman pong dewormer na hindi masyadong safe sa puppies. So depende po. Kailangan talaga kumonsulta kayo sa vet so that you would always be careful before giving a dewormer. Okay? Thank you, Doc Raniel.
All right. Thanks, Doc. No, I really hope we answered your questions, guys. So, if yeah, we're inviting you to comment your questions below kasi maganda nagkakaroon tayo ng discussion on your questions. And nabibigyan natin ng sagot yung mga gumugulo sa isipan natin about canine parvovirus. So now, Doc, no, we were able to discuss again kung ano yung parvovirus, clinical signs, kung ano yung nakikita natin pag may sakit na sila. Now, how can we prevent, Doc, no, tong sakit na ito on contracting or on infecting our canine pets?
Yes, this is the most important and probably the most important to me. Actually, prevention is always number one for me besides treatment, no? Comparing it to treatment. Why? Prevention is very cheap, guys. Always prevent. I always say this in my lectures, in my seminars, okay? Always prevent because it's always cheaper than treating, okay? Okay, I'll tell you how much it costs, okay? Prevention using a vaccine is just, I guess, 500 pesos, 500 to 700 pesos per vaccine. If you treat a dog with parvovirus, it will cost 5,000 pesos to 10,000 pesos. And there is no assurance that your dog will live. Okay? Whenever your dog is confined with parvovirus, 50% of the time, they don't make it. 95% of the time, all puppies don't make it. Okay? Next slide. Okay. How can my puppy contract the virus, right? How can he? Okay, you can always prevent by vaccination. You already know this, guys. It's over and over again. I've discussed this to you. Go to a vet. Okay, ask for the 5-in-1 vaccine. Ask for the 6-in-1, the 7-in-1, and the 8-in-1 vaccine. There's a lot of vaccines available in all vet clinics. Okay, remember that. Don't ever try this yourself. Okay, these are controlled mm, medicines. Okay, there is also a vaccine, a single vaccine, a parvovirus vaccine that can be given if you don't want your dog to have 5-in-1. There is also a one-shot parvovirus vaccine. You can give it as early as 6 weeks of age. Okay.
All right, thanks, Doc, no?
This is also one of the most important uh, besides vaccinating. Okay. Siyempre, when your dog uh, gets the virus, where in your home or maybe in somebody else's home, and you bring a new dog, so they bring the virus inside your home. It's like COVID, guys, right? You have to disinfect your home, guys. And there is a specific disinfectant that only works for the parvovirus. Okay? It's very specific. Okay? Nothing else will work. Okay? Except hydrogen peroxide. Okay? It's the chemical that kills the virus. It's what you call the bleach. Or if you want to have a brand, it's the Zonrox. Okay? That's the only disinfectant that will work against parvo. Okay? So when your dog gets it and he poops and poops all over the place, clean it with soap and water and spray it with Zonrox. Spray it with hydrogen peroxide. Spray it with the bleach. Okay? The virus will be dead by then. Okay? If you don't do that, the virus will live for years in your home, and you would be surprised. Every time you bring a new dog at home, it gets sick with parvovirus. Okay? Next slide, Doc. This is automatic in all kennels in your home. Maintain cleanliness because dogs really, when puppies are introduced in a home, they mess up. They're very playful and they mess up. Okay, just make sure to make your area clean so that in case you get another puppy, they'll be safe. Okay.
All right, Doc, thank you. So now, Doc, no, just want to remind everyone again that prevention is always better than cure. So there are two ways, no, how to prevent. First is vaccination and through disinfection. All right. So Doc, we have ayan medyo dumadami yung questions natin for this specific topic. So first question, Doc. Uh, again, it is a situational question. Is it okay to walk our dogs outside or siguro if safe bang ilakad-lakad no, igala yung dogs nila if he's not yet completely vaccinated?
Yeah, that's a very good question. You would always remember, and guys, I want you to always understand this. Okay, when your dog gets vaccinated, and it's not yet fully vaccinated, because like I mentioned earlier, your dog should get like 4 shots of 5-in-1 or 8-in-1. Okay, for him to become fully protected from the parvovirus. Okay, now once they get vaccinated with just one shot, he is not yet fully protected. Okay, he is not yet fully protected. There is a semblance of protection, but it's not yet 100%. Always remember this. There is no vaccine that protects your dog 100%. Okay? So when I always advise my clients that during the course of vaccination, don't walk your dog yet. Don't walk your dog yet because like I said, there is no 100% protection yet during the first shots. Okay? We are trying to develop the immunity of your dog through the course of the 4 shots. Okay? So pag isa pa lang yung bakuna, wag po muna, i-relax lang, right? Relax. Okay? Huwag nyo munang ilakad. Alam ko excited na kayo eh. Don't be very, very excited, guys. Kasi may sakit, maraming sakit sa labas. Mamaya may dog na nag-poop dyan, may parvo pala. Tapos nag-sniff yung dog nyo. Okay, relax lang kayo. Okay? Wait for the 4th shot. When the 4th shot is done, yes, I will allow you. You can walk your dog, let him loose, make him run. Pwede na. Because he has developed immunity already against the virus after the 4th shot. Thank you, Doc Raniel, for that question.
All right, thank you, Doc, no? That question actually para yan dun sa mga pet parents na mahilig isama yung mga pets sa malling, sa beaches, sa park. So you have to complete first yung mga vaccinations na yung 4 shots ng canine parvovirus bago natin sila ilabas. So Doc, next question daw po. Eto, they're asking if there is a chance po ba na magka-parvo ang isang adult dog if hindi updated ang kanyang vaccine.
Okay, like I mentioned earlier, usually usually adult dog na yung a dog will become an adult beyond 1 year old eh. So usually pag mga 2 years old, baka kasi there are still instances pagka 2 na yung aso, okay, and hindi kompleto yung shots niya, okay, against parvo, minsan tinatamaan pa rin siya. Pero beyond that, adult dogs beyond 2 years old don't contract the virus anymore. Okay? If they exhibit like for example blood diarrhea beyond 2 years old, usually it's a different case. You have to consult your vet. You have to go to a vet. Ako, what I do is I do tests, and most of the time pagka may bloody diarrhea yung adult dog, usually iba na eh. Hindi na po siya. It might be worms, it might be another case, it might be another problem. You have to consult your vet. Pero I'm pretty sure beyond 2 years, it's no longer parvovirus. Thanks, Doc Raniel.
All right, thank you, Doc, no? Eto, let's go now to the next topic. For example, Doc, we weren't able to prevent na magkaroon ng parvovirus yung ating mga puppies. So, can you give us a thought or your expertise on what could be the treatment and how is it going to be diagnosed by the veterinarian?
Okay. Usually, this is very important for vets and for people to understand para maintindihan nyo po. Kasi minsan, akala nyo kasi po, nagmagdadala kayo ng aso sa inyo sa veterinaryo, may parvo na, grabe na. Tapos ngayon, umiiyak kayo. Sasabihin nyo, Doc, please save my dog. I want you to know, guys, that when the vet will do his thing all the time, syempre, diba? You should always consult your vet. So syempre you have to follow your vet. And what your vet will do is he will do a thorough examination. Okay? Ano ba yung gagawin niya with that? Okay? He will get the rectal thermometer. Okay? And he will check if your dog has fever, because most of the time, 100% of the time when your dog has parvo, he has a very high fever. Okay? Very high fever. So, he's vomiting, he's doing diarrhea, definitely has fever. Okay? Now, your vet will conduct tests, guys. You should always trust your vet, okay? Ito, you're very familiar with COVID tests, eh, no? I understand yung walang kwenta lang yung rapid test ng COVID, ano? Pero in parvo, you should trust your vet. The rapid tests for parvo are very, very accurate. Actually, it's 99% accurate. Okay. What your vet will do is he will collect poop from the butt of your dog and put it in a test kit. Okay. Okay. And he will test it. The test results will come out in just like a minute, 2 minutes, or 3 minutes. And the results will come out. It's 99% accurate, guys. So you have to believe your vet. Okay. Once your dog tests positive, okay, once your dog tests positive, your vet will give you an advice. Most of the time, let me always tell you this, okay? It's very hard to treat a parvo infected dog. Lalong-lalo na pag nagtatai na po siya ng dugo. Guys, napakahirap pong i-save nun. Bakit po? Sirang-sira na po yung kanyang intestinal lining sa kanyang tiyan. Sirang-sira na. Mahirap na pong ibalik yun. Lalo na if it's bloody diarrhea already. Ibig sabihin po nun, sirang-sira na yung kanyang intestinal lining. So, it's very hard to do that. Okay? It's very hard to treat. So you have to listen to your vet. What the vet will do is confine your dog. Okay? Like I always say, treatment of parvovirus is intensive care. Ma-ICU po yung aso ninyo. Bakit po? Because it is life-threatening. It's life-threatening, guys. 'Di ba? Bloody diarrhea is very life-threatening. And you cannot just do it at home. It's not that simple. Okay, guys?
Yes,
It's not
that's
that
right, Doc.
simple. Okay.
So, Doc, are there any specific treatment options na pwede nating i-discuss with for parents right now?
Yeah. Okay. When I just mentioned earlier, ICU. Ma-ICU po yung aso ninyo. Ang ibibigay po ng doktor, kakabitan po siya ng swero. IV fluids. Okay? Bakit po kinakabitan ng swero? Hindi na po kumakain yung aso nyo. Hindi na rin po natin pwedeng bigyan ng gamot na ipapainom dahil nagsusuka na siya. Okay? Lahat po ng ibibigay sa kanya orally, isusukan niya lang. Kung kaya't lahat po ng gamot, padadaanin na sa IV fluids. I want you guys to understand this. Okay? Because akala niyo po, napapagastos kayo ng malaki. Talaga pong mapapagastos kayo ng malaki. Why? I'm not scaring you. Dahil hindi nyo po pinabakunahan yung aso nyo eh. Tapos ngayon, mahihirapan kayong nakikiusap kayo sa vet na sagipin yung aso niyo. Diba? Ito na lang po yung way para sagipin namin yung inyong aso. Is to give them IV fluids and padaanin lahat ng gamot sa IV fluids. Okay? Ito, yan. Now, ICU nga po eh. ICU. Whenever your dog vomits profusely and diarrhea profusely, napakahirap pong i-save. Okay? Now, there are certain options. There is another option dahil nga po sa lahat ng tao, dahil sa hindi naman po lahat ng tao ang may kapasidad na makapagpa-ospital ng aso. Opo, pwede rin naman pong gawin na sa bahay gamutin. Pero, lagi ko pong sasabihin sa inyo, hindi nyo po talaga magagawa sa bahay yung intensive care. Okay po? Kaya kailangan makinig kayong mabuti sa advice na sasabihin ng inyong veterinaryo to consider outpatient care. Okay? Meron pong ituturo sa inyo sa bahay. Kailangan you should follow it to the dot. Kasi yung gamot po, padadaanin lahat sa swero. Okay? Katulad po nito, yung antibiotics, padadaanin sa swero. Yung sirinya po, ang gamot na ito ay para sa pagsusuka. para mapigil po yung pagsusuka. Ito po yung mga gamot na kailangan. Anti-vomiting medicines, antibiotics, anti-diarrheal, okay, to completely stop the diarrhea and the vomiting. Pag naputol po yun, pag napigil po yun, gagaling po ang aso ninyo. Pero, depende po yan sa severity nung stage ng inyong aso. Pagka nasa bloody diarrhea na po, napakahirap ng maisalba. Thank you, Dr. Raniel.
Yes, Doc, no. Thank you din, Doc. This is a good reminder din talaga for our pet parents na makita kung gaano ka-complicated and gaano ka-tedious yung ginagawa ng mga veterinarians para lang mai-save yung life ng mga puppies natin. So, Doc Jomer, no, for example naman na, okay, ito na, recovered na si puppy natin and then he is for release na from confinement. Can you actually discuss to us kung ano yung mga post-treatment medication plans na binibigay natin dun sa ating mga puppies na up for recovery?
Yes. Okay. There is a slide here that shows us na kailangan po tuloy-tuloy nating ibibigay yung mga gamot kahit na nakapag-recover na siya from parvovirus. Why? Because he continuously sheds the virus even after treatment. Okay? So usually around 6 months nasi-shed pa rin niya yung virus kasi carrier na siya eh, di ba? Now, pag gumaling na siya, hindi na po siya nagtatae, hindi na siya nagsusuka. Okay? Kailangan i-continue pa rin niyo po yung pagbibigay ng antibiotics. Okay? Your vet will advise that. Tuloy-tuloy po yun. May certain weeks where you should continue this. Tuloy-tuloy pa rin po ang pagbibigay ng multivitamins. Bakit po? Naubusan siya ng dugo nung time na nagkakaroon siya ng bloody diarrhea. Magbibigay po tayo ng prebiotics at saka probiotics. Like for example, Yakult. Tuloy-tuloy pong ibibigay yan dahil po sinira ng virus yung lining ng tiyan. Kailangan ibalik natin yun, right? Okay? Tapos, meron pong immunomodulators para po makatulong bumilis yung pag-produce niya ng antibody sa katawan. Okay? So, it does not end pagkakala mo magaling na. Tuloy-tuloy niyo pong ibibigay yung gamot with the advice of your vet. Okay? Thank you, Doc. Okay.
All right, thanks, Doc, no? Just want to recap lang yung sinabi ni Doc Jomar, no? Yung post-treatment care natin, ito yung linking bridge from being confined into recovery. So we have to follow these recommendations from the veterinarian para tuloy-tuloy yung recovery. Kasi there are chances na hindi natin ginagawa yung post-treatment medication and then babalik ulit sa confinement yung aso. So this will actually help us na hindi na mag-recur yung kanyang disease. All right? So Doc, I guess this ends yung ating topic no for parvovirus. So just a few words lang din. Kanina nabanggit natin that treating parvovirus is costly, but preventing it is cheaper. Right, Doc?
Yes. Yes. Always remember that 500 pesos is definitely cheaper than 5,000 pesos. Guys, remember that.
Yes, that's right. That really is. Prevention is really better than cure. Okay, so parvo is dangerous. It kills, guys. So please vaccinate your dogs. So, Doc, no, we are now opening our program for online consultations. We have here comments from our for parents and viewers that they want to ask you for your advices, no? First question for online consultation, they just want to ask your comment on this. So what can you say or what are your comments about home remedies, no, like ginger and sugar for parvovirus, or are those advisable or not?
Well, actually, for treatments, I don't really advise using ginger and sugar. What is ginger? Ginger is a sort of like a disinfectant, and sugar is a form of energy that you can give your dog. Now, it will never really get rid of the virus. Okay, it will never really get rid of it. It can help later once your dog has recovered as a supplement, but not as treatment. So I advise that you should rely and depend on your vet regarding the treatment of parvo. Okay, and use ginger and sugar later on as a supplement if your dog is treated already with with the virus. Okay, it will never ever hydrate your dog enough for it to be saved from the virus. Okay, so always remember that. Thank you, Doc Daniel, for
All
that
right,
question.
Doc. Thank you, no. Just wanna add lang din po, no. There are certain dog foods that has prebiotics that can actually help your dogs better for their better digestion, no. One of it is Maxime Elite and Maxime dog food. So, Maxime dry dog food and Maxime Elite has prebiotics in it that can actually help our dogs digestion process, no, para mas mabilis natin ma-absorb yung mga nutrients ng dog foods na kinakain ng ating mga dogs. So, yun,
Yes,
Doc.
nutrition is always number one, especially when you're treating parvovirus. Kasi, alam nyo, they don't eat. And when the time that they eat, you should give them top-notch food. And I always believe that Maxime can always provide that food. They have prebiotics and probiotics inside your dog food. And this will surely help in the recovery faster when your dog acquired parvovirus. Okay, so that's really a big help. A very good dog food is very crucial in treating parvovirus. Maxime can do that.
Yes, that's right. It can help you, and it can help the recovery fast for our dogs. No,
Mhm.
Doc, another question, no, from our viewers. So, I just want to ask your comment kasi yung dog daw niya is a parvo survivor. Will it be possible to recur or magkaroon ulit siya ng parvo infection in the future?
Yes, actually, I mentioned that earlier also. Once na magkaroon na yung dog mo ng parvo, never po siya mauulit. Why? Because nakapag-develop na siya ng antibodies against the virus. It only happens once, okay, in unvaccinated dogs. Once they recover from it, they will never ever get it already. But there are times, guys, na akala ninyo, your dog in the future as adults, they will experience again diarrhea, bloody diarrhea. It's a different problem. Okay, it might be caused by worms, it might be hemorrhagic diarrhea. It's another cause. Your vet will identify that. But if your vet tells you that your dog will acquire parvovirus again in his life, that's wrong. Okay, because scientifically, your dog has produced antibodies against the virus. Okay? I want you everybody to remember that. Thank you, Dr. Reniel.
All right, thanks, Doc. No, another question then, they just want to ask and to know if yung parvovirus daw ba has implications on humans or it can be infectious too sa atin mismo, mga pet parents.
Naku, napakaganda question. Thank you for that question. Uh, Actually, it's not a zoonotic disease. Unlike unlike yung rabies, unlike other problems, it's specific for dogs. Kaya lang, it has a very high mortality and very contagious. Now, ang nagiging problema lang kasi, napakahirap po pag nagka-parvo yung aso ninyo eh. Dahil yung aso ninyo po napakabaho ng poop, napakalansa. Like I mentioned, may certain smell siya eh. And naku po, talagang masusuka kayo sa amoy. Dahil ano po bloody pure blood na po yung nilalabas niya sa puwet niya, napakahirap po. Kaya napakahirap din po linisin, 'di ba? Pag may bloody diarrhea, tas napakabaho, napakahirap po. Totoo to sinasabi ko sa inyo, pasensya na kayo. Pasensya na kayo, I'm very, very graphic about this. For you to avoid this, okay, magpabakuna po kayo ng aso. Remember that always, okay? Para hindi na umabot yung puntong mamumblema kayo with this problem. Okay? Thank you, Doc Raniel.
All right, Doc. Now, Doc, we are down to our last question for this consultation part, no? And just want to remind everyone sa ating mga viewers that you can still ask and you can still put your questions on the comment section below and we will get back to you as soon as we can. Promise, balikan po namin kayo. Hindi kami nang iiwan. Okay, so last question, Doc. Eto, very okay itong question na to, I think. And dapat din malaman ng mga fur parents to. Doc, is it okay na ang owner na lang ang bumili ng vaccine at magbakuna?
Okay. Actually, ako po ay may tanong kasi lagi na nang tinatanong sa akin yan. Bakit pag gustong-gusto niyo po kayo ang magbakuna? Di ba? Unang-una po, bawal talaga ang magbenta ng bakuna sa poultry supply. Sinasabi ko na po sa inyo yun. No? Dahil po, unang-una, these are controlled substances. Okay? Hindi po ito parang capsule lang na antibiotic o kaya powder sa poultry supply na nilalagay lang. Kailangan po ito temperature regulated. Okay? Kailangan temperature. Pag nagkamali po ang temperature ng ang bakuna po, kailangan naka-ref. Pag nainitan po ang bakuna, mamamatay po yung bakuna. Kaya kapag binakunan nyo po yung patay na bakuna sa aso ninyo, maaari niya rin pong ikamatay yun. Kaya nga po, it is always advised, okay, to bring your dog to a vet and have them vaccinated by a licensed veterinarian. Hinuhuli na po ngayon yung mga nagbabakuna nang walang lisensya. Hinuhuli po yun. Okay? Gusto ko pong malaman ninyo. Huwag po kayo masyado magtipid. Yung katitipid po ninyo ay maaaring ikasama ng inyong alaga. Unang-una, baka mamaya patay na yung bakunang nabili nyo. Okay? Secondly, kanino nyo ba binili yan? Naka-ref ba yan? Okay? Third, yung pagtitipid po ninyo, maaaring ikasama ng inyong alaga. That is so true. Okay? Magkano lang po ang bakuna, huwag kayong magtipid. Okay? I strongly advise, go to a vet. Okay? And have them vaccinated by a licensed veterinarian. Para wala kayong liability dun sa problema. Kasi pag kayo nagbakuna, namatay yung aso ninyo, sino pong mananagot niyan? Di ba? Sa halagang 300, magkano ba? 500 pesos. Di ba? Isasaalang-alang ninyo ang buhay ng inyong alaga. Please think twice before doing that. Thank you, Dr. Raniel.
Yeah, thank you, Doc Jomar. No? Again, guys, it's against the law na magbakuna ka ng hindi ka licensed veterinarian. And sabi ni Doc, marami na pong nahuli. Gusto mo bang dumagdag pa sa nahuhuli? Of course, wag na lang. Okay, so again, Doc, this ends our consultation, no, online consultation. So once again, I would like to remind everyone that please, you can still comment your on the comment section below and we will get back to you and answer your questions. So, yun, thank you guys no for joining us today and our Facebook group, it's called Popper Central. Yes. When you go there, just join the group, fill up the voucher form posted there, and make sure nakasama ka sa first 80 to Maxime products, no? Okay, hindi lang yon. We will also be giving away many discounts. Since August is a month of a rainy season, we will rain din. Ano? Magpapaulan din kami ng mga discounts para sa inyo. You will enjoy 15% to 20% off on your favorite Maxime and Maxime Elite products on Lazada and Shopee. Guys, we also joined the Lazada. We also joined the Shopee 88 discount promo. So make sure to visit or to log on to your Shopee and Lazada website and search for Maxime and Maximilite products to get your 15% and to 15 to 20% discount on all of our Maxime products. All right, guys. And just please make sure to like and follow Doc Jomar on Facebook and other social media platforms. No, his name there is Jomar Vet, Dr. Jomar Vet. Okay, so please follow him. Madami siyang sinishare doon about co-parenting, about sa ating mga pets. So you will get daily dose of advices from him there. So again, please follow then and like our Instagram Maxim page at maxim.ph. Thank you, guys. So I think that wraps up our first episode, Doc Jomer, no, for our Maxim Talks. And I'm very, very much thankful for all of our po-parents, our fur parents, our viewers right now who joined us in this webinar. And I'm really hoping na sana meron din kayong napulot sa amin ni Doc Jomer with regards to canine parvovirus, kung paano ba ito nakaka-affect sa ating mga puppies, on the treatment, and of course on prevention na parati namin binibigay ng reminder sa inyo, Doc Jomer, prevention. All right. Doc Jomar, thank you so much no, po for joining us today. Would like to request then any message or any final reminder then sa ating mga po parents.
First of all, let me thank Maxime for this episode. And I want to remind everybody to take care of your pets. And if you need anything, you know where to find me. I'm Doc Jomer Vet at Consult a Vet. I have a page also. I have a group. Okay. If you need anything, I'm online 24/7. And I'm so glad to be a part of this project to help others, especially to provide top-notch nutrition to dogs through Maxime. Thank you very much, guys, and hope to see you soon on the next episode. Thank you.
Yes. Thank you so much, Doc Jomar. No? If you have further questions pa, please go ahead and send us a message or leave a comment and we will get back to you as soon as we can. So again, you will see more of Doc Jomar in the coming episodes of Maxim Talks. So stay tuned. So again, this has been your host, Dr. Raniel Montero, and we are saying always do good for your doggo. See you next time.